Hi, and welcome to Senior Moments. This is Jackie Sibley Newton, your host, and we are a broadcast service of Cleveland Community College on C19. If you can't see this on Spectrum Cable, we invite you to share it with your friends and family on c19.tv. And we encourage you to do that for family members or friends who may not be able to get this information any other way. Today, my guest is with Cornerstone Dental. It is Dr. Lauren Massey Williams, and we are going to be talking about specifically the health care of the elderly and the seniors who may not realize the importance of oral health. So tell me what are the primary things that you see in senior citizens who come in with oral health issues?
That's a great question, Jackie. The elderly are specifically part of a more vulnerable population, much like my young children. Those patients are also part of a vulnerable population, simply because it's more difficult for them to sometimes do the oral care that they need to do due to lack of dexterity. Maybe certain medications make it harder. Many of them are relying on assistance when they get older to do the brushing and flossing that they need. So that kind of puts them at a higher risk for things like tooth decay, root surface decay specifically. Many of them suffer from dry mouth due to medication. So all those things kind of combined can make them at a more heightened risk for things like tooth decay and tooth loss, which we hate to see in that population.
Right. And I know just myself, as I'm getting older, receding gums
Yes.
are happening. Like is that a normal part of aging, or is that poor dental health? I'm not sure what.
It can be, it just depends. On some patients, we'll see gum recession due to things like excessive brushing, like brushing a little bit too hard, or maybe they have grinding or clenching. That can cause your gum tissue to kind of shrink away from the teeth is what it looks like. Some patients also have what's called a thin biotype, meaning that their gum tissue is not as thick as others, so it's more prone to things like damage from toothbrush abrasion. But all those things are closely monitored by your dentist if you're able to come every 6 months. The problem with that, the older population, is sometimes due to mobility issues or transportation, they're not able to come every 6 months. So small things like little recession areas that maybe we can catch and monitor or do some prevention, by the time they get to see us, it has advanced so far that now we're looking at more complicated ways to be able to fix that.
So, what age do people tend to drop off of that normal 6 months? Is there like, okay, we stop seeing people when they hit 50 or 60. Is there an age where you're like, okay, they're not coming every 6 months anymore?
Yeah, there are a couple of what I call bumps in the road when it comes to oral health care. Everyone does great when their parents are taking them to the dentist, right? Up until like high school. Then there's kind of like a gray bumpy area for my college students because you're in and out of living at home. You can't make your regular appointments.
We were just talking about
Yeah,
that.
like your daughter. So then that gets kind of bumpy. Then they get their first job and then they can get back on track. And then all the way usually until retirement when insurance benefits are lost or when things start to get a little bit rocky. So we always want to encourage patients, if you're about to retire and lose your dental benefits, let us know. We offer an in-house membership plan that can help support you during that time period so that you can maintain your oral health care. But just because your benefits are gone doesn't mean you don't need to take care of your teeth anymore. And
Right.
Unfortunately, for some patients, they equate those two things together, and then they end up kind of falling out of the system a little bit.
Right.
Even for those patients that do maintain regular appointments after retirement, anything can happen, a hospitalization, an illness, COVID happened. Any of those things that throw you off of your regular 6-month calendar, life is busy and things get caught up in the whirlwind of life, and then they just don't make it back in for their visits.
And 6 months happens really fast.
Happens
before you
really
realize
fast.
it, and you're like, oh, it's time for me to go again. So, and I know that, and I don't know a lot about the dentistry world, but I do know a lot of things like heart disease
Yes.
and a lot of issues can happen because of lack of oral care.
Right.
Can you talk a little bit about the things that
Yeah.
happen because of lack of oral care?
Of course, yeah. So we're seeing a lot of studies now showing that the correlation between things like Alzheimer's and heart disease has to do with bacteria that are present even in the oral cavity. If that bacteria is controlled, then there's no issues. But if the bacteria is not controlled, it travels into the bloodstream systemically. It can go to the brain, it can go to the heart, and there, in those areas, it can cause problems. No one should panic. I mean, it's not like, you don't need to be brushing 10 times a day, but it's really the regular maintenance, the brushing at home twice a day, flossing especially, and then seeing your dentist so that we can do specialized treatments for things like gum disease or an abscessed tooth. Those things can become a real problem if they're not treated early on.
And abscessed teeth can be a much bigger problem.
Yes.
And I know that with my residents that if that's not treated, it can lead to really, really horrifying
Right.
things, especially in the geriatric world.
Exactly, and a lot of times the people that are in nursing homes or assisted living have multiple comorbidities. So it's not just one illness that maybe that has brought them in there. So if you're more immunocompromised, a small infection becomes a large infection really quickly. And then to top it off, if you get on top of the infection and say you need to extract a tooth or do another procedure, well, the healing from that is a lot longer also. If you're immunocompromised, if you have diabetes, all these things combined together can make the elderly a more sensitive population, and their oral health needs need to be kind of at the top of the healthcare priority list. But a lot of times it kind of falls by the wayside because it doesn't seem as important as getting your heart scans or lung scans or things that are seen in the medical world as being more important. But the dentistry is just as important, and it becomes more important the worse that things get long term.
So talk to me a little bit about the importance of, let's say that we're at the point now where we have plates or we have partials, cleanliness of those, because I know that gets neglected a lot as well.
It does. Years ago, I used to do nursing home care. I would, as a traveling dentist, and I would go in and take a look at patients that were there. And one thing I saw a lot was people not removing their partials or dentures. It's a removable appliance, meaning that you need to wear it while you're eating or drinking during the day, but every single night it needs to come out. And when it does come out, it needs to be properly cleaned. If there are repairs that are needed, it needs to be repaired. But I have many times seen patients that have the same level of heavy tartar and calculus I see on natural teeth. It'll be caked onto those partials or dentures to the point where I had one patient, we could not get it out. We couldn't get her partial out, and we had to transfer her to a dental office so it could be cut out. So those things are very important. We want people, especially seniors, to be able to eat comfortably, but if you leave those partials and dentures in with food packed around them, it can be a really complicated issue leading to infection, possibly tooth loss. Yeast infections called thrush can build up in the mouth. All this occurs if those appliances aren't being kept clean.
And it's not just soaking them.
No, well,
and that's kind of a thing that people, well, I'm just going to put them in the solution overnight, which is something you do. You
do, yes.
But you also do have to actually maintain them.
You have to maintain them, yes. And they need to be inspected by a dental office because things like a broken clasp, rubbing can cause an ulcer, or an ill-fitting denture, if it's constantly moving up and down while you're trying to eat, it can cause the gum tissue to swell and be uncomfortable. So yes, definitely taking it out is part of it, but it's multi-step to make sure that those appliances are maintained. Also, your natural tissues need to be checked at least once a year. Even if you have no teeth, we still want you to come in and let us look at your gum tissue because we do an oral cancer exam, we check for things like infection, we check for thrush, things like that. So that's not something you can do at home, so you still need to be seeing your dentist, even if you have teeth that are removable.
So there's a lot involved in dental care at any age.
At any age, yes, exactly.
Is there any age where you're like, oh, it doesn't matter anymore?
No, it matters at every age.
I kind of thought you were going to say that.
No,
but
at every age it matters, and especially here in Cleveland County. I don't know if you know, but last year Cleveland County Water removed water fluoridation from the generalized system. So if you're getting your water from Cleveland County Water, you've already lost one of the biggest protections against tooth decay because that fluoride is not there anymore. So even more so, we want patients to make sure that they're bringing their loved ones in, that they're coming in so that we're able to do those exams as needed.
Now, if they're not getting the fluoride from the water or fluoride toothpaste, does that supplement that, or do they need to do something else?
It depends on their risk assessment. So someone, let's say you're me, and you've not had any cavities in your lifetime and are able to brush and floss thoroughly, then I would say then using a fluoride toothpaste, maybe a fluoride rinse occasionally would be great. But if you have a higher risk for decay, I'm probably going to recommend you doing a fluoride rinse twice a day, or if possible, using one of our prescription strength toothpaste that has a higher level of fluoride than just the over-the-counter.
Now, let's talk about residents or a family member who has dementia.
Okay.
Let's say brushing is, we're not getting a lot of compliance here. We're getting a lot of fighting, a lot of biting. Things aren't happening. We're not able to brush. Are there some alternatives? Are there some things that can be done that if we can't brush, can we at least do this?
Yes. So if they have all of their teeth fully dentate is what it's called, I would recommend you use a warm washcloth after every meal. Wipe around the fronts of the teeth, the backs of the teeth, wipe into the vestibule, get as much of the plaque and bacteria out as you can. If they're comfortable rinsing, let them rinse and spit, hopefully with a fluoride-based mouthwash.
Okay.
Now, if they have teeth that are removable, like we said, make sure that if they're eating with those, you're trying your best to get them out. Even if they won't let you clean inside their mouth, get those cleaned before they're able to put those back in.
Okay.
But that's probably the hardest population to treat because they can be combative and they don't understand. They can't do a lot of the things on their own.
Right.
But just being proactive and kind of staying on top of what's going on with their mouths will be really helpful.
Right. And sometimes getting in their mouth is not
It's not
going to be feasible. And even rinsing, they may not understand spit. So, and swallowing the fluoride may not be
It may
the
not be
healthiest
great.
thing for them. So they may not even be using a toothpaste. They may be using a child's toothpaste
And
just
that's-
because of the swallowing. But that's what we have available, so that's what we can use.
And that's fine. And you can also even, if they'll use a child's brush sometimes, if it has a smaller head, sometimes that's not as intimidating. The back of a baby toothbrush even has these little bumps on it that you can use to
Right.
scrub their tongue. You can kind of go back to those same techniques you use on infants
children.
and toddlers, kind
Right.
of the same thing, just making sure you're stimulating the tissue and getting as much debris off as possible.
Okay. Are there any particular foods that geriatric people should? Of course, I know everybody avoid the sugar. Don't leave the sugar on your teeth. Avoid it as much as can. Are there any foods that are better or worse? Anything that they need to look for in a diet that's helpful?
If at all possible, a balanced diet is great for any person, especially
Any age,
any person. Anytime that you can do foods that you can crunch, apples, cruciferous vegetables, things like that, that also helps to stimulate salivary flow and to move plaque away from the teeth. A lot of sitting, being sedentary, eating softer foods like cakes and donuts and cookies can sometimes accompany getting older, but that's the worst combination because you're sitting there and those kind of stickier, high carb foods are sitting on the teeth. Especially in that population, if they have diabetes, you're trying to maintain blood sugar. So you can be playing a game all day long where you're chasing blood sugars that are going up and down. And you probably know the best way to maintain that is with dense carbohydrates. Proteins will help maintain blood sugar. Those things are great for your teeth too. So if you can kind of think about balancing blood sugar as being a tooth benefit as well, that helps that population
That can
too.
help a little bit. Well, we're going to take a quick break, and then we'll come back and learn more about oral care, specifically in senior citizens.
Hi, I'm Tim Foster, your host for Blue and Bold Monthly right here on C19 TV. Get to know the coaches and student athletes of Cleveland Community College Athletics on Blue and Bold. We go in depth as we discuss cross country, track and field, volleyball, baseball, men and women's basketball, and softball. Catch Blue and Bold airing on C19 TV and online at c19.tv.
Education is our most powerful tool to improve and change our world. Hi, I'm Rhonda Benfield, your host for School Matters. Join me for a new program every other week with information from and about the students and staff of Cleveland County Schools. Discover what our schools are doing to challenge students and help them reach their full potential. You can catch us on Spectrum Cable Channel 19 or stream us live on c19.tv.
Hi, and welcome back to Senior Moments. I am Jackie Sibley Newton, your host, and we've been talking about oral care with senior citizens with Dr. Lauren Massey Williams with Cornerstone Dental. And I want to talk a little bit more about dry mouth.
Okay.
I know with the elderly, that is just so common. A lot of it happens with medication.
Yep.
A lot of it just happens with, like for me specifically, with allergies.
Yeah.
But it's just dry mouth is an issue. What harm is that causing our mouth?
That's a great question, and that's probably the most common complaint I'll hear in my senior patients is all of a sudden I have dry mouth. Unfortunately, a lot of medications that people are prescribed, one of the side effects is dry mouth, specifically medications for blood pressure. A diuretic especially is going to dry your mouth out. So they'll notice that, gosh, I wake up in the morning and I feel like I have cotton mouth. So a lot of things can happen if your mouth isn't properly lubricated. The main thing that I see is root surface decay. We talked earlier about how there's some recession, receding gums. As your root surface is exposed, it does not have enamel on it, which is the great protection against cavities, the hardest layer of the tooth. Instead, it just has cementum, and that cementum is very susceptible to decay. The combination of dry mouth, low saliva, maybe a little more sugar in the diet than we want in that population can lead to rampant root surface decay. Also, around the margins of existing restorations, like a crown that meets up at your tooth, your toothbrush needs to get right at that margin really well because plaque can stick there just because it's not a natural interface like what you have, on enamel.
So it's going to cling to that.
So it's going to cling to that area.
Okay.
So if you have that combined with dry mouth, we'll often see around the margins of a really beautiful crown, there's decay all the way wrapped around, and it's because of that dry mouth that it caused it.
Okay, and I know with dry mouth, we tend to want to drink, and maybe not water. We're going to drink sweet tea, or we're going to drink juices, we're going to drink the stuff with the sugar, or we're going to have the hard candy in our mouth all the time. And anything like pain medications tend to cause dry mouth.
They can, yes.
Lasix for the fluid. And then my allergy medicine is what causes mine, I'm sure of it.
Exactly. And the best defense against that, I tell patients, have your water with you all the time. If you're traveling somewhere, have water in the car. Keep a bottle in your purse if you're female. Make sure you're just grabbing one when you leave the house. Because you're right, the tendency is to kind of slow sip on a sweet tea or a Diet Coke or something like that. But that's the worst
That's
combination.
not what you want,
And it's
no.
not actually quenching your thirst. You're still thirsty because you're not
Right.
getting what you need. So water, water, water as much as you can.
And with our, with people with dementia or Alzheimer's, I don't know if you know, but one of the last senses to go in taste is sweet. So at some point, all they want is sweet because that's all they can taste.
Yeah.
Nothing else is going to taste good. Everything I've been told kind of tastes bitter or it just doesn't have a taste at all. So the only thing they can taste is sweet. So everything that they want is going to be sweet. They're going to want the sugar all the time.
Well, and I did not know about that, but that does make sense now with some other things I've seen. A great alternative for that is that you could do xylitol candies for them. Xylitol is a sugar alternative. It's made of a sugar alcohol. It is sweet like candy, but it's not going to make you have tooth decay like typical sugar will. So I've suggested that before, and that's great. Your natural sugars are not going to be as harmful. So your fruit sugars, you can do a fresh fruit.
We do a lot of fruit.
A lot of fresh fruit, that would be great too. But I understand that. I mean, if that's your, one of your last joys is eating, and then to take that away from them, I mean, I understand.
We do sweet potatoes. We do a lot of sweet, the sweet vegetables, corn or sweet potatoes are really popular.
Yeah.
And then we have been known to put Splenda
over
or stevia over their foods to get them to eat regular food, but it has that sweet taste, so they'll eat it.
They'll eat it.
And they're not getting sugar, but they're still getting nutrition. And then also just foods that have a lot of water in them, like watermelon or foods that grapes have a lot of water.
Exactly.
So try to get those in them too.
Yeah,
so
we're
that
headed
helps a lot.
into the summer months, and I feel like it's easier to do
that.
positive changes when
Yeah.
all the good fruits are in season. But yeah, definitely, those are all wonderful alternatives.
So how else can caregivers help support geriatric health? I mean, we've talked a little bit about diet, but how else can caregivers help?
Well, and I think the weirdest thing for our patients is that they don't know that they need to probably look in their loved one's mouth occasionally just to kind of see what's going on in there. Like if you know that they wear dentures, it may be a little awkward at first, but maybe take a peek in there and see how things are looking. Or if you see a tooth that's broken off or they're constantly kind of struggling to hold them in place, it might be a time to give the dentist a call because an ill-fitting appliance like that can do a lot of damage to their tissues and it's uncomfortable and they're not going to wear it properly if it doesn't fit well.
We notice too if they just stop eating.
Yeah, and they won't say anything.
They
They'll
won't
just
say
stop,
anything, I'm just not eating, or they're picking the soup and the soft foods only, like what's happening there? It's because their mouth is really uncomfortable,
Yeah.
and they're not saying anything. They're either not saying anything or they can't.
They can't. Or if they're a patient that has a chronic pain condition, if they're taking a pain medication all the time, that can dull the symptoms of something like a toothache. So I've looked in a patient's mouth before and said, oh my gosh, like that doesn't hurt you?
How
And
are
she
you
said,
not-
well, no, I take, X, Y, and Z for back pain, 3 times a day. So
didn't notice.
I didn't even notice it. And at that point, it can get to an abscess situation. It can get to
Right.
something that's not restorable simply because no one had looked to see what was going on in there.
So caregivers, when they're providing oral care support, need to actually look in there.
They need to
Not
take a
just run
peek.
the brush over, but like just give it a little pull the gum aside, look around and see what's
Yeah.
in there.
To look for
Okay.
anything that's out of the ordinary, any changes, anything you think might need a little dental attention. And the worst case scenario is you take them to the dentist and we say, okay, no, it's not a big deal. But 9 times out of 10, that's not what it's going to be. There probably is
Right.
some treatment that needs to be done.
And then as a caregiver, if you're caring for someone at home, make sure that somebody's getting to the dentist.
Yeah, make sure they're getting to the dentist. Make sure you're physically helping them brush and floss their teeth every day because flossing especially is tricky when you start to lose dexterity. And sometimes patients may be embarrassed to ask for help for things like that. But if you just go ahead and offer or say, hey, I got you floss picks to try, or we're going to start using this power toothbrush that'll help you get all the surfaces a lot easier, just kind of letting them have autonomy, but still realizing that there is some assistance that needs to be done.
And that was my next question. Are there tools to help with that, and
Yes.
are they okay?
Yes, they are okay. I would say I recommend for all patients a Sonicare or another type of electric toothbrush. Just because you're unable to brush too hard with those, the bristles are moving, so they're getting all areas of the tooth. The heads are smaller, so you're able to get in smaller areas of the mouth. I really don't like using a manual brush when I travel because I'm so used to that Sonicare.
Right.
But for the elderly especially, that's a great way to make sure you're not missing areas. It's not uncomfortable. It has a timer, so we're doing it for 2 minutes and not cutting it too short. And that way we're really able to get them the oral health care that they need.
Right. And then what about the dental floss, like the picks? I keep them in my car.
Yes.
And I was always like, are these okay? Because
Yes.
in my car, it's just really convenient.
They're convenient.
Because I
And-
can grab them out, and it's got the toothpick on one end, it's got the dental floss on one end, and it's just easy to use.
Right. So every dentist will probably tell you they're not our favorite tools because I personally like to get in there with the floss wrapped around my fingers. But if I was flossing another person, especially someone that maybe doesn't have a lot of control or I'm trying to get in there really quick, that's great to just kind of pop in out of those contacts, making sure you're getting everything out from between the teeth.
Right.
Because even the best brushing is never going to get in between the teeth. So the fact that at least once a day you're getting in there, getting in between the teeth, that's great for
Right.
them.
They're good for the car.
Good for the car, on the
Somebody
go.
use at home, but they're great for the car.
Yeah, or if you're traveling to visit someone that's in a care facility, just keep kind of those in your bag. You can even get from Walmart or Amazon those tiny little dental mirrors that we use, a plastic version, in case you need to just really kind of look in there and check mom or dad's teeth and make sure nothing is going on before you can get them for a dental visit.
Okay. So are there any other devices that are specifically helpful for people that might have trouble brushing on their own, but they want to keep that independence?
Well, it depends. So I will always recommend, like I said, the Sonicare, the electric toothbrushes. You can modify a manual toothbrush. I've had patients in the past add a tennis ball, like they take a tennis ball, cut it in half, and then duct tape their toothbrush to the inside of it so that they have something bigger to hold on to. Because sometimes holding a smaller thing, it becomes
It's
more
really
challenging.
impossible, right.
So they've done that. You can modify it in that way. Rinses are great because they're going to kind of wash over everything, even if you're not able to brush it really well. And like I said, if you can't any longer wrap the floss properly to floss in between, use the floss picks and get between the teeth.
Okay. And then a good oral rinse is also a really good idea just to follow up
Yes,
for
but
everybody.
just making sure that you choose one without alcohol. You don't want it drying the tissues out anymore.
Okay.
So make sure you read the label. Even some of the more name brand ones, if you read all the ingredients, the second or third ingredient is alcohol. You don't want that one. Use the
Okay.
ones that are alcohol free and that have fluoride. Those are the best ones.
Okay. Are there any other helpful tips that we should cover for oral care specifically for seniors?
The only thing I would say is if you don't have a regular dentist, we would love to see you at Cornerstone Dental Associates. We see people of all ages. We even honor our patients that are 80 and older with at least 20 natural teeth with a wonderful party every year called the 80-20 party because we really do care for that population, and our goal is to get everyone into that club. We don't want anyone falling off and losing teeth and being uncomfortable. We want you to enjoy your senior years with all of your teeth if possible. So that would be
That
my
is
only
a goal.
comment. Yeah.
Yes, you definitely having your own teeth versus a partial or false teeth
I agree.
is way better.
I know.
So
I
if
can
you
make you a beautiful denture, but it will never compare to what
Yeah,
God
if
gave you.
you
So
can
we want you to maintain
hold
that
on
as
to
much
those.
as you can.
want to hold on to those
Yeah.
as long as you can, and with proper dental care, hopefully you can.
Yeah.
But no matter where you are in life, oral care is important at any age, no matter what's happening. We
Yes.
need to take care of our teeth
Take
and our
care of our
gums.
teeth and our tongues and our appliances if we have those in there
I think
too.
people forget about the tongues.
Yeah,
You know,
tongue,
they
yeah.
forget to brush. I do. I forget about brushing my tongue.
Don't
sometimes,
forget,
but-
Jackie, brush your tongue.
Brush my tongue. Brush the tongue. It's important. Well, thank you so much
Yeah.
for being on the show and for this valuable information. I've learned a lot to help my residents, and I hope that everybody out there has learned a little bit more about oral care. And if they're caring for somebody, they've learned a little bit more about how to help and prevent diseases and
Yeah.
help prevent oral diseases
Yeah.
as well.
We'd love to help you. So anytime. Thanks for having me.
Thank you so much. And thank you for watching Senior Moments. We'll invite you back next time